Can you tell us a little bit about the thyroid specifically in cancer, risks involved, or are there things we could do to avoid it, or is it just something that some people are more prone to?
Yeah, thyroid cancer is becoming increasingly prevalent, especially in the United States. And most people have no risk factors for thyroid cancer, but there are some things to keep an eye on. First thing is if you have a family history of thyroid cancer. If you're a female, females have a higher chance of thyroid cancer than men. If you have exposure to radiation in the head and neck, and that doesn't just mean dental X-rays, because a lot of my patients say, oh, I get dental X-rays, and they forget to put the thyroid thing over, which they always do. But it's really somebody who's had, a lymphoma, Hodgkin's lymphoma, and had thymic radiation, because the thymus is right here, and it's right next to the thyroid. So if you have had radiation to the area, if the residents in Chernobyl or not Fukushima, those are patients that have had excess exposure to radiation. Those patients are more at risk for thyroid cancer.
Right, and there are so many unknowns that we just don't know
absolutely.
about, chemicals and exhaust fumes and things that we just don't know. So there are other potential causes for these nodules as well. Can you kind of comment on this as well?
Yeah, sure, absolutely. So thyroid nodules are very common. They're even more common than thyroid cancer, especially in women. More than half of women get thyroid nodules in their lifetime. And most of those nodules, about 90–95%, are nothing to worry about. Some causes of thyroid nodules or enlarged gland would be iodine deficiency. But again, usually that doesn't happen in the United States. But worldwide, that is the most common cause of an enlarged gland or thyroid nodules. If you have a cyst, with cyst, it's just really a nodule that's filled with liquid. The nice thing about cysts is that they're usually benign. So if you have a thyroid cyst, it's less likely to be a thyroid cancer. Thyroiditis, which is an immune reaction in the gland, it causes a lot of inflammation in the gland, and you can get nodules that kind of come and go, and it's related to the immune reaction. And then multinodular goiter just means you have multiple thyroid nodules.
Wow.